Welcome back to the show. We are so glad you're joining us today because we have a stack of sources that is going to completely flip the script on something you probably thought you understood.
Yeah, we really do. It's a pretty wild shift in perspective.
Right, because usually when we hear terms like, type 2 diabetes or uncontrolled blood sugar, our minds immediately go to a very specific set of images.
Mostly food.
Exactly, food. We think about insulin, maybe we picture a glucose monitor. It's um, it's almost exclusively framed as an energy problem, right? Like a metabolic issue involving what you eat and how your body processes that fuel.
Yeah, the cultural conversation, and frankly, even a lot of the clinical conversation, it centers relentlessly on the glucose itself. Like the sugar is the villain, so the sugar gets all the attention.
And looking at the stack of sources we've pulled for you today, a totally different, almost hidden crisis emerges. We're looking at NHS and NICE clinical guidelines, deep systematic reviews on vulvovaginal candidiasis, and even cutting-edge sports science research on muscle hydration.
Which is such an interesting mix of sources.
It really is. And when you layer these different fields on top of each other, they reveal this massive misconception. Uncontrolled blood sugar isn't just an energy problem. It is a profound whole-body water problem.
Right, and it forces a total reframing of chronic hyperglycemia. We have to stop looking at it just as a surplus of fuel and start looking at it as a structural assault on the body's fluid dynamics.
Okay, let's unpack this. Our mission for today's deep dive is to map out this systemic dehydration. We want to show you how high blood sugar essentially turns the human body into a desert.
Basically pulling water from everywhere.
Yeah, from muscles, skin, mucous membranes, leading to some terrifying consequences. But before we get to the symptoms, I want to understand the physical mechanism. I know glycogen is how we safely store glucose, but why does the body go through so much trouble to package it all up instead of just leaving it in the blood?
Well, to understand the drought, you really have to look at the molecular physics of sugar and water. The body strings individual glucose molecules together into a complex chain called glycogen, specifically to solve a pressure problem.
Okay, a pressure problem. How so?
Because glycogen is brilliant, it's non-osmotic, so it can safely bind to 3 or 4 parts of water for every 1 part of glycogen without fundamentally altering the pressure inside the cell. It's just a really stable storage unit.
So it's kind of like dropping a massive salt block into a balanced freshwater fish tank. If you leave it as a solid block, the overall pressure of the water doesn't drastically change.
Right, exactly. The tank stays balanced.
But in uncontrolled diabetes, that packaging system fails. The insulin isn't there to open the cell doors, so the glucose stays trapped in the blood.
Yeah.
And if that salt block dissolves and becomes free-floating particles, well, the physics of that tank completely change.
Yeah, the environment instantly becomes hypertonic. Free glucose is highly osmotic, meaning it exerts this powerful pull on surrounding water.
Like a magnet.
Exactly like a microscopic magnet. When you have high concentrations of free glucose trapped in the bloodstream, the body is always seeking equilibrium. So, to dilute this heavy concentration of sugar in the blood, the circulatory system starts aggressively pulling water out of the surrounding cellular reserves.
So the blood is basically stealing water from the rest of the body to thin itself out.
Yeah.
And the kidneys get caught right in the middle of this, right?
Oh, absolutely. The kidneys are the primary filtration system, and they have a very specific threshold. Normally, they filter blood, reclaim the glucose, and send it back into circulation. But when blood sugar levels breach that threshold, the kidneys are just overwhelmed. They can't reabsorb all of it. So the excess glucose starts spilling over into the urine to be excreted.
And because of that magnetic osmotic pull you mentioned, the glucose doesn't leave the body quietly. It drags massive amounts of that stolen water right out the door with it.
Yeah, this physical dragging of water is what causes polyuria, which is that frequent large volume urination that is a hallmark symptom of diabetes, especially at night. Right. The body is essentially flushing its own reserves down the drain just to get rid of the toxic levels of sugar. And naturally, as you lose all that internal water, it triggers polydipsia, which is an intense, unquenchable thirst.
That unquenchable thirst is such a classic sign.
It is, but what's fascinating here is that thirst is actually a lagging indicator. It's not the beginning of the problem at all.
Wait, really?
Yeah, by the time the brain receives the chemical signal to make you consciously feel thirsty, the osmotic drain has already done significant damage. Your internal fluid balance is already deeply compromised.
Wow. Okay, so if the kidneys are aggressively flushing out all this water day and night, the blood has to keep replenishing its own volume from somewhere. And the sources we looked at point to the muscular system as one of the biggest victims of this theft.
They do, yeah.
But I was genuinely surprised to see sports science research in a deep dive about diabetes. Why is muscle tissue so vulnerable here?
Well, muscle tissue makes up a huge percentage of our total body mass, and it holds a massive amount of our total body water. When the hypertonic blood starts pulling fluid, the muscle cells lose their intracellular volume. They literally shrink.
They shrink. Just from the water loss.
Yes. And from a biochemical standpoint, muscle protein synthesis, which is the process of repairing and building new muscle fibers, it absolutely requires a robust aqueous environment. The cytoplasm inside the cell has to be fluid for these reactions to occur.
Okay, I want to push back on that for a second, just to make sure I understand the mechanics.
Yeah.
Why does the actual chemical reaction of building muscle care about how wet the cell is?
Yeah.
Like, if the building blocks are there, shouldn't the body just build it?
That's a great question. The physical machinery of the cell, specifically the ribosomes that assemble amino acids into proteins, they rely on fluid dynamics. Proteins fold into their correct shapes based on complex interactions with water molecules.
Oh, like hydrophilic and hydrophobic interactions.
Yeah. Exactly. If the cellular environment is dehydrated, that folding process becomes incredibly inefficient. Plus, the cell membrane is lined with mechanosensors. When the cell physically shrinks due to fluid loss, these sensors interpret the loss of volume as a state of critical distress.
Like a survival threat.
Precisely. The body interprets the shrinkage as a catabolic signal. It assumes it's starving or dying, so it triggers the release of stress hormones like cortisol.
And cortisol breaks things down.
Right. Cortisol actively breaks down tissue for quick energy and slams the brakes on any anabolic or growth signaling. The body's basically saying, we are in a drought. This is no time to spend energy building new muscle.
That's wild. So theoretically, someone could be tracking their macros flawlessly, eating a high-protein diet, lifting heavy weights, getting perfect sleep. But if they have uncontrolled hyperglycemia, chronically draining their cellular fluids, they're literally chemically blocking their own body's ability to build or even maintain muscle.
Yeah, I mean, the raw materials are useless if the factory floor is shut down, and the problem compounds when you look outside the muscle cell to the delivery system itself.
The blood.
Right. Blood plasma is roughly 90% water. Systemic dehydration shrinks your overall plasma volume. Your blood literally becomes thicker and more sluggish.
Which means the transport system carrying oxygen, amino acids, and nutrients to the working muscles is severely compromised.
Exactly. Not to mention, the removal of metabolic waste stalls out.
The sources had some staggering statistics on this. A drop in body water of just 2%, which is roughly 3.6 pounds of water for a 180-pound person, that can reduce muscular strength output by up to 15% and power output by 20%.
You have to remember, for an athlete, a 2% drop happens after a really tough, sweaty workout.
Yeah.
But for someone with uncontrolled diabetes, that state of dehydration is chronic. It's their baseline.
Their muscular system is just constantly operating in a depleted, chemically hostile environment.
Yeah, it's fighting an uphill battle every single day.
So if the deep internal reservoirs, like the muscles, are running dry, the body has to start making some harsh triage decisions. It's going to protect the vital organs at all costs. And according to the clinical reviews, that means sacrificing the outer barriers, like the skin and the mucous membranes.
Triage is the perfect word for it. The body actively restricts peripheral blood flow and decreases non-essential secretions to conserve fluid for the heart, brain, and lungs.
Which makes sense for survival.
It does. But the immediate casualty of this is the epidermis. Water is pulled from the skin, resulting in an incredibly dry, flaky, and intensely itchy surface. And the loss of elasticity means the skin cracks easily, which physically breaks the barrier that keeps environmental pathogens out.
And the systemic reviews we pulled on vulvovaginal candidiasis paint an even more complex picture when this drought hits the mucous membranes.
They really do. The vaginal ecosystem relies on a very delicate balance of moisture, pH, and specific bacteria, primarily lactobacilli, to maintain an acidic, protective environment. When systemic dehydration forces the body to pull water away from these mucosal tissues, natural lubrication diminishes drastically. This causes severe microscopic friction and tissue damage.
But the cruel twist here is that the tissue isn't just dry. Whatever minimal fluid is present is completely saturated with the excess glucose that the body can't process.
Yeah, you are looking at an environment that is simultaneously fragile, micro-torn from dryness, and heavily concentrated with sugar. This completely destabilizes the acidic pH.
creating a nutrient-rich feeding ground.
Exactly. It heavily promotes the proliferation and adherence of Candida species, so yeast.
A microscopic buffet.
Mm.
The data shows diabetic women are up to 4 times more likely to suffer from vulvovaginal candidiasis, and the risk extends to bacterial infections like group B streptococcus as well.
Because the high glucose environment actively feeds the pathogens while simultaneously disarming the host's defenses. We rely on white blood cells, specifically neutrophils, to patrol these tissues and engulf invaders through phagocytosis.
Right, they act like the cleanup crew.
But neutrophils require a specific osmotic balance to move effectively and consume bacteria. In a highly concentrated, sugary environment, their mobility and their ability to actually destroy pathogens are severely impaired.
Here's where it gets really interesting, though. When you look at modern interventions for diabetes, there is a fascinating paradox with a specific class of drugs called SGLT2 inhibitors.
Oh, yeah. If we connect this to the bigger picture, the mechanism of SGLT2 inhibitors perfectly illustrates the tension between systemic and localized treatments.
Because these drugs are designed to lower overall blood sugar by intentionally forcing the kidneys to excrete even more glucose into the urine, right?
Exactly. They bypass the kidney's normal reabsorption process and just dump the sugar out.
Which sounds great for clearing the systemic backlog. But by doing that, they are inadvertently funneling massive amounts of concentrated glucose directly through the urogenital tract.
It's a huge trade-off.
You are taking a local environment that is already dehydrated, fragile, and immunocompromised, and you are intentionally bathing it in sugar several times a day.
Right. It creates a severe iatrogenic risk, which is a side effect caused by the treatment itself. The drug successfully pulls the lever to fix the blood sugar crisis, but in doing so, it provides unlimited fuel for localized fungal and bacterial infections. It's a constant tightrope walk for clinicians managing these patients.
We've tracked this drought from the bloodstream into the muscles and out to the body's defensive barriers. But if this feedback loop of high sugar and extreme water loss isn't broken, the sources outline a final catastrophic systemic crash, which is diabetic ketoacidosis, or DKA.
Yeah. DKA is the ultimate biological emergency. It is the culmination of every failing system we have discussed today happening simultaneously.
Let's walk through the exact mechanics of this crash. We know the cells are essentially starving because they don't have the insulin required to unlock the doors and let the glucose in. But how does that cellular starvation trigger a lethal acid problem?
Well, the liver acts as the body's metabolic sensor. When it detects that the intracellular environment is completely devoid of glucose, it assumes the body is undergoing extreme starvation.
Even though there's plenty of sugars in the blood.
Right. It doesn't know there is a surplus of sugar trapped in the blood. It only knows the cells are empty. So in a desperate bid for survival, the liver dumps counter-regulatory hormones like glucagon and epinephrine, and it triggers massive lipolysis, which is the rapid breakdown of fat stores for alternative energy.
Which sounds incredibly efficient, except for the byproduct of that specific chemical reaction.
Exactly. The rapid metabolism of fat produces organic acids called ketones. In a normal, healthy state, the body can utilize a small amount of ketones perfectly well.
But this isn't a normal state.
No, in this panic state, the liver is churning them out at an industrial, uncontrolled rate. Because ketones are highly acidic, this massive accumulation fundamentally alters the pH of the blood, driving it down into a dangerously acidic state.
The blood is essentially becoming toxic, and the clinical guidelines highlight some very specific visceral symptoms when this happens. Beyond the deep abdominal pain and sudden crushing fatigue, the breathing pattern completely changes.
Yeah, the respiratory system tries to compensate for the toxic blood by forcefully expelling the acid. The patient will develop heavy, labored, deep gasps known as Kussmaul breathing.
They're literally trying to exhale the acid in the form of carbon dioxide.
Exactly. And because one of the primary ketones produced is acetone, the breath takes on a very distinct chemical odor.
The sources describe it as a strong, fruity smell, or like pear drops or even nail polish remover.
Mm-hmm. But the most devastating physical reaction to this intense blood acidity is severe nausea and vomiting.
Which is the absolute worst thing that can happen, right?
Mm-hmm.
I mean, we've established the body is already in a profound state of systemic dehydration from the kidneys desperately flushing out the glucose.
Right, and the vomiting accelerates the fluid loss exponentially. The patient cannot hold down water. The dehydration becomes so profound that the blood volume drops precipitously. The blood becomes thicker, which means the kidneys lose their ability to filter anything anything at all, so the glucose and the ketones just continue to skyrocket. The acidity worsens the vomiting, and the vomiting worsens the acidity. It's a fatal feedback loop.
So for someone listening, maybe monitoring their own health or keeping an eye on a family member, how is this actually stopped? You clearly can't just hand them a sports drink to rehydrate.
No, definitely not. DKA requires immediate, aggressive hospital intervention. The treatment protocol directly addresses the mechanisms we've unpacked today. First, they need massive volumes of intravenous fluids to forcefully restore the blood plasma volume and reverse the critical dehydration.
Getting the water back in.
Exactly. Second, they need precise IV replacements of the electrolytes like sodium and potassium that were dragged out of the body through the urine. And finally, they need intravenous insulin to force the cellular doors open, let the glucose in, and signal the liver to stop the panic-induced breakdown of fat.
And without that three-pronged medical intervention, the brain simply cannot survive the lack of fluid and the extreme acidity. It leads to unconsciousness, coma, and eventually death.
It really is the ultimate tragedy of human biology. The body is literally starving for energy and dehydrating to death, all while floating in a bloodstream that is absolutely flooded with energy it can't use and water it can no longer hold on to.
That is an incredibly stark image. To bring all of this together, we started today talking about how diabetes is always framed around food, insulin, and energy.
Right.
But when you trace the path of that excess glucose from the liver to the kidneys and watch it strip the water out of the muscle cells, see it dry out and crack the skin and the mucosal barriers, and finally trigger the catastrophic acidic dehydration of DKA, the narrative completely changes. Uncontrolled blood sugar is a master thief of the body's water.
It really is. It fundamentally compromises the structural integrity of every single cell. The chemistry of life requires an aqueous environment, and chronic hyperglycemia slowly drains that environment dry.
So managing blood glucose isn't just about keeping a number on a continuous monitor in a specific green zone so your doctor gives you a thumbs up. It's about protecting the cellular machinery of your muscles so they can actually repair themselves. It is about maintaining the moisture in your physical barriers to keep invasive pathogens out. It is about preserving the basic fluid dynamics your heart and brain rely on.
Absolutely. And this raises an important question, though, doesn't it? If we consider how aggressively the body relies on robust hydration to dilute and flush out these metabolic toxins, it makes you look at our modern lifestyle through a very different lens.
Oh, where is your head at with that?
Well, consider the baseline state of most people today. A massive portion of the population walks around in a mild, chronic state of underhydration. We don't drink enough water. We rely heavily on mild diuretics like coffee and energy drinks. We are essentially always a little bit dried out.
Right, our internal reservoirs are rarely fully topped off.
So could that baseline state of underhydration actually be masking the early warning signs of metabolic dysfunction?
Oh.
If the body needs immense optimal amounts of water to efficiently flush out early spikes in excess glucose, and we simply aren't providing that fluid, does the concentration of sugar in the blood rise faster than it otherwise would? If we were all perfectly, optimally hydrated every single day, would our bodies be able to flag the subtle hints of insulin resistance much sooner, long before the cellular drought turns into full-blown diabetes?
That is a brilliant question. If we didn't start every single day as a partial desert, would we spot the actual drought sooner? It's definitely something to consider the next time you find yourself reaching for a glass of water. Because as we've learned from the sources today, an unquenchable thirst isn't just a nuisance. It is the sound of a cellular desert crying out for relief.